Okay. All right. I think we're about to get started here. So, hey, all, welcome. Thank you for being here. My name is Marina, and I'm hosting on behalf of NuRelm. This webinar is designed for researchers and clinicians interested in learning more about how AI is transforming mental health care and research by automating routine tasks, harnessing smart sensor data, and enabling predictive insights. We'll also talk NuRelm's vision for a more personalized, human-centered mental health app. This is part of our technology for human behavior and intervention research webinar series, which is kind of a mouthful. If you want to keep up with our webinars, follow us on LinkedIn. We're also on Blue Sky and X, and we have a newsletter you can sign up for at nurelm.com/newsletter. So we are recording this, and it will be available on our website. An email will be sent out tomorrow with links to the recording and the slides. We do encourage you to put questions in the Q&A section for Sam to answer later on in the webinar. Our speaker is Sam Shaban, co-founder and CEO of NuRelm. And with that, you can go ahead and take it away, Sam.
Hey, thanks, Marina. Hey, everybody. All right, so this will be a, a good part of an hour of a fairly opinionated webinar on AI and how it seems to be affecting things. So I'm not just going to give you a breakdown of what's happening or a list of tools that are out there, although that'll be part of it, but I'll give you a lot of opinions and a lot of our thinking about how we're thinking about and handling AI here at NuRelm. But first, just a quick intro. I'm the co-founder of NuRelm, started the company about 25 years ago, and we specialize in custom software development. And our focus, our primary focus nowadays, is really working with healthcare researchers and clinicians and building oftentimes digital mental health apps. So we consult as early as proposal writing all the way through the close of the study. And we also do a lot of work lately on our own products as the lead on small business innovation and research projects. We have a really amazing team here at NuRelm. Marina is one of them. And we have a lot of really amazing clients. The average employee stay right now has been over 6 years at NuRelm, and we have clients that have been with us for over 15 years. So I think those are some of the things that I'm the most proud of, is just having a really good team and a really good group of clients who I hope, this means appreciate working at a place that appreciates them. So, oh yeah, here's the text for things that I didn't click on when I was saying them. And just a quick disclosure, we're a for-profit company. We often work with universities and for-profits and nonprofits as a vendor. And then sometimes, as I mentioned before, we lead our own projects and sometimes hire those former clients to be folks that work with us on those projects. So we do a lot of really fun work. And one of the big things that we're enjoying thinking about right now is how AI is going to affect us and everybody else. So as an intro, I imagine whoever's listening is, a researcher, scientist, clinician, maybe a developer. You could be anybody. I think these ideas are going to be fairly broad, even though we'll talk a lot about mental health research. These are a few of our clients here that I listed. And I'm assuming, you love your work. And like us, you're still trying to figure out how all the hype is going to affect your work. So we'll talk about that and think through it. Check out our website. I did not include this QR code this time, but if you check our website, we have some good stuff, white paper on building research studies and mobile apps. We have lots of webinars that we put on in this series. Those things are available on our website, and we can send you more information about it. So today's topics, there's some sort of revolution supposedly in mental health with AI. We'll talk about that and where it fits. We'll think about AI and how we think it can empower human connection, reinforce human connection rather than kind of degrading it, which is kind of one of the worries out there. We'll talk about some ways that artificial intelligence kind of meshes with all these sensors that we all wear around on our bodies nowadays. We'll talk about predictive power of AI and how that can be used for good. And then we'll talk about our vision here at NuRelm and what we're thinking about. I'll share some of the things that we've been talking about internally and think about how those things might apply to you or how you might think about those things. So let's get started. Is it a revolution in mental health? Is it a paradigm shift? I don't know. Let's talk about that. So here's some fun quotes that I found. First of all, just to get started, not necessarily super relevant to everything, but some people, like the famous B.F. Skinner, famous psychologist, said the real problem isn't whether machines think, but whether we do. AI is about amplifying human potential, not replacing it. So this is a little more hopeful, and little less jokey. I think I agree a little bit without that. And then back to the direction of B.F. Skinner, artificial intelligence is no match for natural stupidity. Of course, garbage in, garbage out. We'll talk a little bit about how those things might work. Stephen Hawking didn't think much of all the decimation and manufacturing jobs that AI and automation caused. So this is not a hopeful quote. But then on the other hand, this is a hopeful quote. AI mirrors the best and worst of humanity, or even um, neither hopeful nor unhopeful. This is a computer scientist who's thought a lot about AI ethics. What's sort of a funny quote. AI doesn't hate you, it doesn't love you, but you're made of atoms, which it can use for something else. I think that's kind of a funny sci-fi quote. But I think what we really are thinking about, all of us in all of our different fields, is how's AI gonna possibly screw up our jobs or what we do? So I kind of like this quote. AI is not gonna take away jobs, but maybe somebody using it might, unless we think about it kind of head on and really think about how we're going to use it in our work, and how it kind of fits with our work instead of being afraid of it, which is really kind of easy, I think. And I know I've been in that position. So, okay, what is AI? I know everybody has heard this plenty, but I think this is a good way to think about it. I think old-fashioned code, if you've heard of a coding language like JavaScript or Ruby or C or whatever, C sharp, I don't think old-fashioned code is AI. Back in the olden days, for those of you who were around for the expert system days, people tried to create something that was smart with this really explicit logic, if this, then that kind of logic. Um, Old-fashioned code is sort of part of a system in which AI fits, but it's probably not what most of us think about right now when we think of AI. Then, comes machine learning. So these models that have gotten so popularized in the last decade or more, where, we're using neural networks and all sorts of different techniques to really learn patterns. This is a little closer. This is something that can be thought of in a lot of different ways as a really big part of AI. In fact, machine learning lives under the hood of these large language models that we'll talk about in the number three here. And of course, these large language models, which are based on this idea of a transformer that we won't talk about today, but they're based on this kind of mathematical construct that really makes them good at, I think I heard somebody call it the other day, extruding words, creating words that are the next word in a sentence, thinking about not just what's the next most likely word in the sentence, but they actually have an ability to care more about certain words and understand context. I think a really cool example, or a really simple example, is I hit the ball with a bat. Um, when I say that, all of you probably conjure up a baseball bat in your mind. But if I say I hit the bat with a ball, then you probably are like, well, I don't know. I guess it could be a baseball bat, but maybe it's really the kind of bat that flies. So transformers have the ability and these transformer-based LLMs to sort of understand those kinds of nuances and kind of get which direction your sentences are going. And of course, they've proven incredibly helpful in a lot of different things, which we'll talk about. But before we talk about that, let's talk about what AI can actually do. And then the next slide, let's talk about what it's really not that good at all. So AI is great at generating content. That's a big worry out there. Everybody's worried about too much AI generated garbage. But really, if you give AI good ideas and you want it to generate something, it'll generate oftentimes a pretty good starting point for content. And it's not, we can say what we will about it, but it's not bad at this. AI is really good at consuming content. So processing whole big piles of information and turning it into key points, that information being language, which we work best with as humans, is pretty cool rather than kind of an artificial language like a programming language. And then finally, we mentioned this a little bit with the machine learning kind of piece before, but AI is really good at recognizing patterns. So keep these three things in mind as we talk through everything, but let's keep them in mind, especially as we talk through what AI is really bad at. AI does not have true empathy and does not understand emotional nuance. It can synthesize it, but it doesn't yet. I don't know what will happen in the future, but it's not feeling anything, even if it sort of makes you feel like it is. This isn't really happening under the hood. Common sense, generalization, AI really can repeat what it knows, but it doesn't, within a model that's already been trained, it doesn't learn from what you talked about other than remembering what you talked about. It doesn't take examples and create new ideas or create common sense out of that. It only knows what it knows. And it's not able to go beyond that unless you explicitly tell it to go beyond that or provide a way for it to do that. So it's not like, it's not like a 4-year-old who plays around with some balls and then figures out how gravity works. AI doesn't do that. It either knows that or it doesn't know it. I think really related, genuine creativity, but ethical judgment. We have to instill AIs with some sort of ethics framework because that's not gonna be there automatically. And there's tons of debate about how that should work. There are companies that really think a lot about that. Anthropic and Claude, they try to think about this ethical framework, and tons of philosophers and computer scientists are talking about how we can do this. But it's not a thing that's built into AI, really. It's something that we have to we have to wrap around it, at least not in the the form of AI that we understand today. And then, really from the perspective of a mental health care professional, this is a key. Well, I guess all of these are, but this one is important. AI does not establish deep human relationships or care or build trust. It may seem to, it may help you feel that it's doing that, but that's not really a thing that's built into AI. So, thinking about this, all of this, I think when we discuss how AI can and will fit into the mental health landscape, it's really important to think about how we can use it ethically, and you know, and think about how I'll talk a lot more about this as we go, but how we can use it to include more of the human to human interaction, not less, which I think is a little counterintuitive when AI, you think about automation and you think about people doing less, but I think about people doing less of the stuff they don't want to do and more of the work that really is valuable. And we'll talk about that over and over again. Um, Mental health, just two examples. AI and mental health. There have been some really good successes. There have been examples like this one where researchers use AI to look at data, digital phenotypes, and come up in this case with early signs of schizophrenia for a targeted intervention. So, really cool example, looking at a bunch of data that really isn't getting looked at this way. Maybe it is more and more, but coming up with really good things to intervene upon before they turn into problems. And then we've all heard of the really bad examples, like this AI chatbot, Tessa, from the National Eating Disorders Association, that ended up providing, terrible dieting advice and had to be taken offline. So, there are lots of different directions things can go. I don't want to, cast any shade on whoever came up with Tessa. I'm sure they were doing their best, but it's easy to kind of go wrong. It's a powerful tool. It's not a new mental health professional or a replacement. It's a great triage tool. Maybe it's not a great treatment tool, at least not yet. So we'll have to think about how we can, I think, again, reinforce that human AI collaboration. All right. So next section, beyond automation. And I guess, we'll start with the question kind of stemming from what we just talked about that everybody sort of has. So if you're a sci-fi consumer, you can think about what's in the parentheses here, bad AI, Blade Runner. There's, this society of mostly poor with a handful of rich. And sometimes it feels like maybe we're going in that direction. I think this is what we want, in my opinion, to avoid. And I think when I think about AI and how we should use it, I think about doing so in a way that acknowledges that this is a possibility and avoids it at every turn. I think that's a big challenge for our society to keep doing, but that's the way I think about it. And then of course there's the Star Trek scenario, the good AI, computers, bots, whatever, take on tedious work. They free everybody for more creativity and deep thinking. This aligns with our values here at NuRelm, and I'm sure most of yours. But this, there's definitely a possibility that our future could go in either of these directions, or to some degree, both. But what I'll talk about today is how I think we can go in the second direction. So, thinking about that, we here at NuRelm had an internal meeting recently, and we thought a little bit about, what do we actually do? Do we code? Are we programmers? We build code for people. That's one of the things that we do. But is that really, really what we do? Is that function the key function? And I think I'll just show all of these now. I think we're, creators and collaborators and innovators. We build, we help people take an idea and nurture it into something that can actually be used and actually help people. Do we, are we going to identify only with programming? And keep in mind, for those of you who aren't, thinking about this, programming is one of the things that AI does really well, or at least helps with really well. So, there are a ton of really good programming tools out there, many of which we're using, that really make the task easier. So we've had to think a lot about what we do in this new world, because if we think of ourselves simply as building code, that first slide in the kind of three kind of worlds, code, neural networks, and LLMs, I don't think that's quite right. I think that's something that's not gonna be needed as much, but I think really good code builders who understand things is needed. So I'll quit talking about this because this is our example, but what I really wanted to do is set the stage to talk about this in your perspective as a clinician or a researcher. What do you really do, really? I don't know the answer to that, but I have some guesses. And I think that all of the clinicians out there don't identify their primary role as taking patient notes or tending to your EHR, or entering data. Right? That's not what you'd really like to do. Probably is work with people and patients and do more of the work that you actually enjoy. You're probably annoyed by a lot of the things that I listed here. And then similarly, for the researchers in the audience, you probably not excited with dealing with paperwork for your review board, or doing incredibly tedious data collection work. You probably both have a mission where you want to help people, you want to explore, you want to create something. So I guess what I'm encouraging here is the same exercise that we've taken as a company that's, doing one of the things that we do is something that AI is really good at. I think you have to think about the same thing in the same way. And I think you really have to think about if we, do this right, if we make this transformation correctly, what we hope is that AI is going to replace the parts of our jobs that we didn't want to do in the first place. That's the hope. So, here are some examples that just a quick look on the internet. You can find some really cool healthcare examples. So there are tools out there that I'm sure anybody in the clinical world knows about, at least whether you know about these two that I listed or some other tool that'll listen to your client patient conversation and generate notes. We use a tool in meetings. There are a lot of these AI note takers. We use one called Fathom, and there's another one that a few others that other members of the team use, but they do the same thing, and they're actually really good. And in the case of a clinical version, they'll generate draft notes, and you, as a clinician, will go through and just make sure they're right. And that's way faster than generating these notes from scratch. And these tools are getting pretty good. There are some efforts out there to make your work in the electronic health records easier by summarizing data. Really, summarizing complex patient histories is really key. And the tools that are out there to do this kind of stuff will do so with references to the document that they're summarizing. So you don't just have to trust them. You can read this, and if you're interested in something, you can click on the reference and go to the actual patient document. I see referral management, which is really hard. I see that there are companies who have at least raised money to go out there and make this kind of slow process faster. Mental health apps, there are lots of them out there. It's the jury's still out on which ones are good and which ones are not so good. And we've built some that we'll talk about in a bit, but they're out there. And then there are some triage tools that can help do some of the before work to send somebody to the right place and to sort of empower people to get what they need without having to talk to somebody at that first step when they might still be kind of shy or hesitant or not want to put out the outlay and effort. There are tools out there that let you have a chat, and then that chat bot will send you to the right person. And I think, in all of these examples, um, well, to more or less greater or lesser degrees, you're not trying to sort of cut out the human, although some of these mental health apps might try to reduce human interaction, and those may be the ones that are the most questionable in terms of their their longevity. But for the most part, they're kind of just doing the part of the work that's not any fun anyway. All right, so let's kind of step back from the higher level ideas, and we'll take a look at some apps in particular, some ideas in particular, and I'll share some of the things that we're working on. So, sensor data. 1 in 3 of us have some sort of smartwatch or fitness tracker. I have a smartwatch here. I'm testing one here for a project we're doing at work. I bought one of these cheap glucose monitors for consumers that I'm trying out. Sensors are very inexpensive and they're very easy to use for most people. Most adults in the US have a smartphone, and all this stuff's really growing fast. So, if we think back to what AI does well, what if we had tools that could process all of the sensor data and do something interesting with it? Look for data, look for patterns in that data. Well, it turns out that that's exactly what a lot of the machine learning tools out there do, and it's certainly what large language models can do as well. Particularly if that data is English data, although they're being used for a lot of other stuff. So I just want to tell you about a project that we're working on as a specific example of thinking about this. So we do, as I mentioned before, a lot of what are abbreviated as SBIR projects. Those are small business innovation research projects with the government that they're paying for small businesses to go out and build these ideas that might be risky. So we're working on one now called Lemur DX, and the idea is ADHD, attention deficit hyperactivity disorder. It's pretty common, and there's no really objective way to measure one of these pieces of this, which is hyperactivity. You use a bunch of forms that you give people It's hard to get consistent results. It's hard to get fast results. We've been working on this project without going through this with researchers at Pitt and CMU for almost a decade. We weren't involved at the very beginning, but we are now. And I guess the question is, we prescribe stimulants to kids, and you figure that process is pretty objective. I won't make you read this. I'll read you a couple of quotes, but we interviewed a whole bunch of people, and the quotes are, it's really hard to get these surveys back from teachers. The process is rudimentary. It's very biased. It's not an exact science. It's hard with younger kids. There's a huge backlog for assessments, for full assessments. There's not enough providers. I guess all in all, this sounds like a great thing to figure out how to make objective and automate a part of so that the providers, the clinicians can actually deal with the kids and just have a quick way to say yes or no. It seems like this thing that we're interested in exists in this child without spending a ton of time and a ton of effort to do that. So in this project, that's exactly what we built. We built an app that runs on smartwatches, Apple Watches, and collects data on motion and movement data. We built a data processing pipeline, machine learning pipeline, and then a nice portal for clinicians to look at. So without the need to look at the small print here, we built this first data collection system, and it's something we'll probably take out into the world to see what if scientists want to use it soon. And then we're actually in the midst of a 3-year trial. We're almost at year 2 of the trial to build this algorithm to detect hyperactivity. And I guess, in terms of all the things that we've been talking about, this is a way to use the sensors that are out there, to use machine learning and AI to automate a thing that is not particularly interesting thing to do so that researchers and clinicians can actually focus on the interesting thing, which is how do we help? How do we make it better? If the hyperactivity that we're measuring is a problem, how do we make that better? If it's not a problem, but there are other problems that are exacerbating it, how do we work on those and then quickly look at the hyperactivity? So I just think this is like an ideal use case of how do you take all this technology, all this AI technology, and do something that fits all the things we talked about before, giving humans more time to actually talk and work with humans. So, okay, that's an interesting example on the sensors and kind of getting outside of the office without being outside of the office side. Let's look at predictive AI. We talked a little bit about this. There was an example I gave earlier, but here's an example that's based on another project that we've worked on. So, as a clinician, a mental health professional in certain areas, there are things that can happen that are rare, but really big problems. Suicidal ideation, psychotic breaks, bad depression. There are lots of conditions that they don't happen very often, thankfully, but when they do, their impact can be really disastrous. But given the need for careful monitoring, traditional monitoring is problematic. These methods often rely on, an appointment every once in a while, or somebody calling the clinician when they're in the worst state of their life to report that they're having a problem and getting themselves to the right place when they're having this really bad problem. So, there's kind of a mismatch here. And I think AI does have the promise of monitoring for certain conditions, kind of like the ones that we talked about or along the lines of what we talked about. And I'll give you one example. So this is another SBIR project, another small business innovation and research project. We worked on this with another researcher at Pitt and another colleague at the University of Virginia. And the idea is that, well, I'll tell you what this app does in a second, but I'll give you a quick peek at the problem first. So mental health problems with adolescents were getting worse before the pandemic. They certainly got worse during the pandemic, and they're not getting any better now. So these are rising trends in suicidal ideation among students from 2010 to 2021. So, this thing's gotten worse by 10%, 11% among female students. And I don't know, lots of theories why, but this kind of goes back to that big problem, like that I mentioned on the earlier slide. If you think that somebody might have minor depression or mild depression, you go to the doctor, your kid's got mild depression. How do you monitor them to know that the small percentage who turn from mild depression into suicidal ideation are caught early enough so that they can be taken care of and helped? It's really hard. You're not going to get that family to come back once every 2 weeks or once a month or something like that. It's really tricky to get them to come back often. So, wouldn't it be cool if there was a system that could keep track of that and give everybody that needs to know a ping if it looks like their mood is getting worse? So that's what mood ring is. And this is an idea that our collaborator at Pitt, Anna Radovic, came up with. And the idea is to collect what we call passive sensor data from a phone, which everybody has, not even a wearable, but just a phone, and look at patterns of screen time usage, activity, location, all these sort of basic call activity, and look at these things and use these patterns to predict if somebody's mood is getting worse or better. We also built a companion app for parents where kids can share their mood scores, teens can share their mood scores, and then a dashboard for clinicians. So we built this in such a way that the teen can control who gets to see what. So you can control whether a parent or a guardian gets to see certain things. And then, the clinician part, if it was distributed through a clinician, they would get to see the results. And the result was pretty impressive. We had 85% accuracy predicting week to week changes in depression scores. And this is pretty preliminary work, but the project looks really promising. And the idea that it's trying, what it's trying to solve is right now, the current standard of care is patients, clinicians, parents have to recognize, like I said before, that something's getting worse and they've got to go out and seek help. Um, in the mood ring situation, the patient, the parent, the clinician is actually prompted with a message that says, "Hey, is something wrong? Do you need some help? Can we help you out?" All you have to do is push a button to do that. And then communication channels start. Um, Same thing for, appointment timing. It's really hard to figure out how to time appointments. Clinicians are really busy. It would be really nice if you knew an appointment was for something that was actually a problem or could be a problem or preventing a problem. And this is really, building this sort of thing is really, to me, kind of an ideal use of AI in that you've got a really busy professional who would love to monitor 1,000 of their patients all the time, but they don't have time to do any of that. Their staff doesn't have time to do any of that. The best they can do is get more people to come in for follow-up visits. Most of those visits aren't going to be for any problem because most people don't have a problem. So to me, this is like cuts really right to the heart of like making more time for a human to see a human, but not feel like they're missing something in the middle. All right. So let's come to our vision, what we're thinking about in terms of where this is all going. All right. So AI is, I think, useful in a couple of ways. All of us are in, undergoing an informational deluge right now. We've all got way too much information, which is completely the opposite of the majority of history when we had too little information. Even I'm 53. I remember going to the library to look stuff up. It was really tricky. You had to ask somebody to help you figure out how to do it. You don't have to do that anymore. In fact, the thing that I primarily struggle with is how many interesting emails do I delete, like newsletters and things like that, or how much time do I spend digging around or chasing threads? There's just too much out there. And then I think on the clinician side, I think it's pretty agreed upon that the majority of clinicians are really overworked. They've got too much work. Their appointments are shrinking. Insurance doesn't want to reimburse you for hanging out with somebody for 30 minutes. And they're, really struggling just like everybody else to figure out where to put their attention. And these are things that I think AI can really help us with. And I think if you sort of take all the examples that I've given so far, that's kind of the direction that we're going. So let me give you like one really simple example. So this is a personal example. One of the things I think about, I try to be healthy and keep myself, from having any problems. And as you age, you accumulate data, medical test results, things that you've observed, things that you've collected, and you also accumulate ideas. You have your values and the things that you think are, your goals and what you want to do. And it's sort of nice to have somebody to talk to about those things. And it's not going to be your doctor. If you want to optimize all these things, they don't have time to sit down with you and say, "Oh, let's have an hour-long conversation about the sorts of things that you want to do." So I created something. I use a chat system called Gemini. That's Google's version of Chat GPT. And they have this thing called a gem. And a Gemini gem lets you give it instructions. You're an unbiased personal advisor designed to help me analyze my uploaded documentation regarding my health, values, blah, blah, blah. And then you can upload a bunch of documents. And then you can talk to this thing and you can ask it stuff. So you give it instructions, you tell it, don't be a sycophant, don't, give me real answers, data-driven answers. Don't just tell me what I want to hear, etc. And then you upload a bunch of documents, uh, and then you can talk to this thing about a lot. So this is a really interesting and almost free. I think it might be free. I think this might come with Gmail or something, way to really sort through stuff. Now, I know probably the medical professionals in the audience are like, "Oh my God, Dr. Google, you're going to ask this thing medical." Well, you don't. I think the smart way to use it isn't to ask it medical advice and then go out and do it. I think it's to find things that you might want to talk to your doctor about, and have some humility that your internet machine doesn't know everything that your doctor knows, but it does help you experiment with ideas. But I think it opens up a lot of questions. What else does this apply to? I think we use the same concept at work for projects now. I use it at home for various hobbies or things that I'm really into when I want to have a big bunch of information. A big question is, how can it be really private? Right now, I'm relying on Google not to do anything bad with my data, but maybe one day it's still hard to run these models locally, but I don't think that's going to be the case forever. It's already possible, and I think soon it's going to be more feasible. How can I automate this? How can I pull data in from my healthcare provider, my own data? And something I think about all the time. How can I own my own data? I don't really like it that UPMC owns all my data or Allegheny Health Network or whatever. And then, how should this really work if we did something like this in the future? Like, is there a medical system that this should interact with? Is there a way we can think about it that is actually safe? So just a lot of questions, but I think this is like a really tiny microcosm example of how we can use the tools that are out there to deal with this deluge of information. And then I think similarly, clinicians are overworked. We've given a bunch of examples about how some of these tools could help with that. Mood Ring is a great, kind of example of an aspirational tool that we're working on. But a lot of the sort of lower risk note taker tools that are out there are really sort of part of this idea. So I think, we're going from kind of like basic tools to help you take notes or summarize notes, to eventually more complex tools in mental health that are going to help us triage patients and figure things out, that we might not otherwise be able to figure out, and monitor people that we wouldn't otherwise be able to monitor. So we went back again at NuRelm. I crossed out NuRelm and included all of our values in an AI world. But, as we thought about this, we thought that AI should help us be more values driven. Really think about, in our case, collaboration and creativity and exploration, the values that we're most interested in. We asked how we could, of course, use it to make us more efficient. I think that's the place that we think about it the most, or that the public thinks about it the most. But, also, how can AI let us be more thinky? Marina and I were just chatting before the presentation about how using AI to help you with coding means you have to get really, really good at knowing how to ask for what you want. So you really have to think deeply about the thing that you want if you're going to cause this thing to do anything close to what you actually want it to do. And then I think the thing that overlaps between us at NuRelm and your clinical practice, for those of you who are clinicians out there, is, how can using AI not pull us away from clients, but give us more time to help those clients do the things that they need to do? And I think, in our case, everything's changed, but nothing's changed. We've wanted since 1999 to improve lives through technology. So I think we can still do that. In our case, in the programmer's world, there are lots of dumb ways to use AI. Vibe coding means, often it's taken to mean that you don't really know what your code does, but you're just telling an AI to do it. There are lots of AI only support. You'll never call and have an AI support person handle your call. And then I think, maybe more relevant to everybody else, smart AI use cases are, how do we get more time with clients? How do we have more time with each other? How do we train? How do we provide more training opportunities? AI is a great training tool for topics that it knows well. And then really, I think it's exciting. AI lets us really iterate on new ideas quickly. So it lets us build new ideas, at least proofs of concept really quickly. And I think that's something that's going to be shared with most healthcare practitioners. So internally, some of the projects that we're working on that might be interesting are two of the projects that I've already told you about. The lemur data collection system with wearables, that's something we're going to roll out soon to researchers so they can collect wearable data without, kind of in a turnkey way instead of having to build that technology. The mood ring tool that I told you about that tries to predict depression, we're thinking about updating that tool and coming up with some partnerships that do pull the human in the loop at the right time. And then internally, we're just really trying to be very mindful about adopting AI and adding AI-based insights to a lot of the tools that we use. So our next steps here are really just exploring how we can use these tools. We have a few projects that we're starting to play around with internally. We're really trying to document standards for how we're going to use AI tools and really think about responsible use and clear guidelines that reflect our values, not the go 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 values of the market. So in summary, AI is good at a lot, but it's really pretty bad at a lot. And the things that it's bad at are the things that humans are really good at. Now, it sounds obvious, but I don't think it's always the thing that we think about. Like, it's not advertised that way to us sometimes. So, AI strategy, it really revolves around the core of what you do, not the mundane tasks surrounding it. So I would encourage you to think about what you really do. It's probably not the really boring stuff that AI can do for you. AI should augment human connection, and I thought about that in a couple of different ways in the examples. Objective measures based on all this data that we have out there, and then predictive measures that are tailored to each of us so that they can help us reach out to the right people at the right time. And I think underlying all that, good AI strategy is a strategy that supports our values. And that's it. Thanks everybody for your time. And if anybody has any questions at all, I would be happy to answer or try to answer.
Yes, please add your questions to the Q&A feature. And I just want to remind you that we also have a quick survey that appears in your browser when the webinar ends. We'd just like to know how you found out about it and what you liked about it, what could be better, if you have any ideas for upcoming webinars. Um, let's see. Uh, well, while we're looking for questions, I have a question for you. So for researchers interested in collaborating with NuRelm on AI-driven mental health app development, what's the typical process for an initial idea to a deployable solution?
Uh, Probably the same process as always. We end up chatting with somebody who's got an idea, and those ideas can come in a lot of different formats, from really early, brainstorming session to really well
Hmm.
developed, where somebody really knows what they want. So we recommend just giving us a shout, and then we can talk, do like a free consultation, and then think about what a good next step would be. Maybe that next step would be more of a brainstorming session, or wireframes that are really easy to update that could be put together, but really kind of thinking through the implementation of it, and uh, kind of the pitfalls, the potential pitfalls, especially if it's an AI idea. If you wanted to create an AI chatbot to talk to kids, we might have a lot to think about in terms of the potential ways that could go sideways. But we can help you think through all those things. But I don't think it's too different than any other consultation or project, getting together and thinking about the beginning pieces of it.
Yeah, great. Um, how about this? What are the biggest challenges in getting buy-in from clinicians and researchers for adopting AI tools in their daily practice, especially considering the ethical concerns and limitations of AI you mentioned?
Oh, that's a good one. I think even in a situation where it's not AI, where you want somebody, a practitioner, to adopt something new, the burden of proof and safety is pretty high. So it's going to be tough to get clinicians to adopt something if they're not really convinced that it's safe and it's efficacious. So I guess that's one pillar. I guess another is it has to be integrated in some way with the world that they live in, so that they don't have to like go to a new website and have a new login somewhere. So it's got to fit in with the tools that they use. Um, and then I think the third pillar is there has to be some mechanism for them, for it to be paid for by somebody, right? That's one of the hardest things about
Hmm.
healthcare, is it's not like the person who walks into your office is necessarily the person who's paying for the treatment. So it's got to be integrated. So that makes things really hard to deploy in a healthcare world. You really have to think about a lot of moving parts. You have to have great
Hmm.
proof. It's got to be integrated really well, and it's got to have some sort of payer mechanism associated with it.
Right. This is a question that I've been seeing a lot, but I think it's good to consider. How can we ensure that AI-powered mental health apps are accessible and equitable for all populations, especially those who have limited access to technology or come from diverse cultural backgrounds?
Oh, it's a good question for every every new technology, and it's unfortunately one that's not always answered well. It's easy for us to imagine that the things we have access to are available to everybody, but it's not always the case. I think in a lot of these cases, we're talking about technologies that can be made available to the clinician. So in that case, even in a a space where there's the population that doesn't have as much technological access, hopefully their clinician can spread that access via, we're talking about like ideas that will give the clinician more time to spend with
Hmm.
people. So hopefully that does that. But I think then we start thinking like outside of the US and clinicians that don't have access to these things, and I think that might be a bigger policy question of how do we think about the world as a place where we all live instead of like us versus them and try to expand that access. Right now, I think most of this newer AI technology is being given out almost for free. Not for free, but I'm guessing it probably costs more than an average of $20 a month to have a Chat GPT account. You probably have to burn 3 trees to run the data center for a second that this thing comes with. So things are still pretty cheap. I don't know where that cost model is going to pan out though in 10 years.
Yeah. So, well, let's talk about data and privacy. With the increasing use of sensor data and passive sensing, how does NuRelm ensure the robust privacy and security of highly sensitive mental health data, especially considering potential oh my gosh, words, regulatory changes like HIPAA?
Well, when we build an app and we have complete control over the infrastructure, it's relatively easy. We can do that in the HIPAA compliant fashion that we're familiar with. We, secure everything. Data is always secured in transit. Databases are encrypted and so on and so forth. I think the hard part comes when you have to use external services, so it's going to be unlikely that we're going to use a large language model that we host ourselves, although it's not impossible. It's for sure something that can be done. But the thing that you can host yourself is never as powerful as the monster models that are hosted by, OpenAI and Google and those big companies. So really that comes down to having an ironclad data privacy agreement with those companies that you trust. So once you start sending data to a third party, you really have to dig into their privacy agreement, make sure they're not going to take your content and use it to train future models and all this kind of stuff.
Great. Would you like to answer any more of of my lovely questions,
Well,
Sam?
they're great, great questions. Only if you want to ask, but I think we are getting close to the end of our time. So
Yes.
um, maybe we should wrap it up.
Okay. All right. That sounds good. Well, thanks everybody for joining. And like I said, we will be sending out a recording of this tomorrow. So thanks again for your time. All right.
Thanks,
Bye.
everybody. Thanks, Marina. See ya.